All right. Hi, everybody. Welcome to tonight's Tales of the Treatment. It's been a while since we've done this, so super excited, and we have something a little different tonight. So thank you all for spending your evenings with us. My name's Macy. I'm on the growth team at Field Trip Health, and tonight I'm joined by two amazing Field Trip team members, not just one tonight. So I'd like to introduce you to Dr. Mike Dow. He's our wonderful psychotherapist in the Los Angeles clinic. You might also recognize him from the Today Show that just aired last week. And he's all over our social media. He's chock full of knowledge. We adore him. So we have Dr. Mike. And then we also have Dr. Monique Mahler, who is our VP of Integrative Health. And she's a consultant physician based out of our Toronto clinic. We adore her. She is all things freedom, which is our new program. She's been spearheading that, and we're really excited to have her on board to talk a little bit more about that. So super excited to have these two. We also are going to have a former client on who I will add shortly, and he'll be able to talk to you about the experience at Field Trip, how ketamine feels, and how he's doing now. So I'll add him momentarily. But I just wanted to kind of just give an overview of what we're doing tonight and a few housekeeping items before we begin. So the intention for tonight is that you hear from our team directly about ketamine-assisted psychotherapy and our two programs specifically. So Dr. Mike is going to talk about our in-person program, and Dr. Monique will answer questions about our new offering, which is Freedom, our hybrid at-home in-clinic program. It's also important to us that you hear from a client, a real person just like you and me who have gone through the program and just understanding that point of view. So he will detail the process of what it looked like for him and where he is now on the other side of treatment. So thank you again for joining us tonight. Just a few housekeeping items. There's going to be a chat bar to your right, which we invite you to use for your thoughts, any questions throughout the session. Hey, Grant.
Hi, how are you?
How's it going? I didn't even have to add you. You figured it out yourself.
Yeah. The website was like loading for about 10 minutes, and it was like, my internet's fine.
Weird. Well, thank you for joining us. You came at the perfect time. So, as I mentioned, everybody, we have a wonderful former client on, Grant Miller. So he'll be able to talk about his experience with Field Trip. But just to finish up the chat bot, or the chat box rather, feel free to drop your questions in there, introduce yourself, say where you're from, anything that comes to mind during the session. And if you have any questions, you could either put them in the chat, or there's a questions tab, which you could find near the bottom right corner of your screen. This way our host will have a much easier time to see and respond to your questions. So yeah, we're really excited to open the space for those who are interested in what we do. And I'd like to turn it over to Dr. Dow, who could start us off with a quick overview of ketamine-assisted psychotherapy, why it may work for you, and what makes Field Trip special. We'll save 10-15 minutes at the end for any questions. So Dr. Mike, ketamine-assisted psychotherapy, why ketamine? Why do we pair it with therapy? How does it work in layman's terms?
Yeah, so this is a groundbreaking protocol. In my decades in mental health, I've never seen anything work so quickly. I've never seen anything, when combined with therapy, that is really not just hitting biological, but also the psychological and the spiritual. So it is really this truly whole person oriented way of treating mental illness. And, it's really interesting, we've got this medicine, ketamine, that was used as anesthesia. It's been around for about 60 years. It was invented in the United States in Detroit, Michigan. And, it was just, sort of a standard tool in the toolbox of many anesthesiologists and ER doctors for decades around the world. About 20 years ago, they started to realize that after a single dose of ketamine, people with severe depression or even suicidal ideation would feel a lot better. So we've got this very fast-acting antidepressant. The downside of those original studies was that the boost in mood is only lasting a day or two. So that brings us to this more modern protocol that we've got and that we do in the in-clinic model at Field Trip, which is, number one, stacking a bunch of sessions to start. So typically you're going to start with anywhere on average from 4 to 6 sessions of ketamine-assisted psychotherapy sessions. So you're going to be in the clinic with somebody like me for about 2 to 3 hours. And we're going to probably want those to be within a roughly 3 to 4 week period. Then in between, so the stacking of the doses is remarkable in and of itself. But then, to me, the real magic is when you add the psychotherapy component. So in some of the other research, we see that some of the IV ketamine clinics that only use the same sort of stacking that we use without psychotherapy, it's only lasting about a month. Whereas our protocol, when you're combining the magic of psychotherapy, so you can talk about your interpersonal relationships, your spiritual life, your career, your goals, and you've got this medicine that is helping to really improve your brain. And it works. I want to talk about how, I consider ketamine sort of this hybrid between the classical psychedelics, but it also has properties of modern psychotropic medication. So it's to me, it's this wonder drug in many ways. And when you combine those two things together, you've got this really robust response. You're seeing dramatic improvements in symptoms. And the way we go about the symptom reduction, to me is a much more functional approach. And when I say functional approach, instead of just sort of looking at, well, let's just sort of tinker with the neurotransmitters. And if somebody's depressed, let's, tinker up the dopamine or the serotonin. If somebody has anxiety, let's tinker up the serotonin or the GABA. Ketamine does a lot of those things, but it also has this very spiritual component. I think one of my favorite things about the medicine with psychotherapy and why it works so well, I was just doing a session with a new patient who happens to be a physician. So he's very familiar with the medicine, but he said to me after our first 15 minutes, oh my gosh, I can't believe how deep we just went in the first 15 minutes of our first session, right? So ketamine is an empathogen. It opens your heart, your defenses come down, and spoiler alert, if there's something in the back of your mind that your inner healing intelligence, your subconscious, some part of you knows that you've got to work on, which in standard talk therapy, if you want to be avoidant, it can be very easy to be avoidant. Ketamine really helps you to not just access it, but talk about it in a way where you feel, to me, very safe most of the time, right? So, for this a physician I was treating just yesterday, it really allowed us to process and go back to early memories of childhood trauma and some of the things that were related to some of the problems that he was having just today in his everyday life. So I really think it's that magic of this wonderful medicine with the psychotherapy where, a lot of you probably came to us for that. And it's in my opinion, just remarkable.
Thank you for that. So eloquently stated and so expertly stated. Thank you. So something came to mind as you were talking. I know that ketamine works on neurotransmitters, right? GABA, glutamate, like you were talking about. How can we explain that in a way that makes sense to somebody who knows nothing about psychedelics or brain science? Like, I'm trying to think about the people who want to explain this to their families, like maybe their mothers or their grandparents, and saying like, I want to work with psychedelics, and it's not just like I'm tripping and partying and that's my way of healing, but it works on the brain because of what, so how can we explain the brain science of psychedelics and specifically ketamine in a way that's like super easy to comprehend?
Yeah, so I would say this. Ketamine does a lot. So I would say ketamine lifts your levels of neurotransmitters. Ketamine has been shown to relieve inflammation in the brain. Relieving inflammation in the brain is important because for many people, neuroinflammation is the root cause that is sometimes causing the symptoms. Ketamine improves and enhances connectivity in the brain. Ketamine can deactivate the ego and the parts of you where rumination and the inner critic and the negative self-talk reside. So when you have a medicine that does all of those things, people can start to understand, oh, this isn't just, quote, getting high or going on a trip. This is something that is having very real measurable effects on the brain that researchers for decades have been saying, oh, maybe this is the real cause of mental illness, right?
Right.
The other interesting thing about glutamate, so there are these downstream effects. So ketamine tends to lift dopamine, serotonin, and GABA, but it does so by targeting glutamate. Now, glutamate is the most abundant neurotransmitter in the brain. So if you kind of think of like these older antidepressants, and these neurons that have got to talk to each other via these neurotransmitters and sort of artificially stopping up your neurons so that more of the neurotransmitter can sort of be in that space between your brain cells, that more can sort of travel along. Glutamate is sort of just like making your neurons release, right? It's when we say excitatory, it's like, let's release those messages in your brain, which, we're still doing research on like why exactly does ketamine work so quickly and so well, and why do over 90% of our patients at Field Trip, our clients, have very significant reductions in depression and anxiety. And we're not talking about a 20% reduction. So, we use two standardized assessments called the PHQ-9 and the GAD-7 that measure depression and anxiety respectively. And we're seeing people, on average, they're coming to us with severe symptoms. And by the time they finish these 4 to 6 sessions combined with psychotherapy, we're seeing them fall all the way down into like the lowest category of both depression and anxiety on average. So it's pretty great and pretty cool to see. It's,
it is.
And you've also got a protocol that once in a while, if somebody has something like grief or loss, what other treatment on the face of the planet is that person maybe going to have an encounter with their loved one who is passed over? And whatever, I'm not telling you to believe this or that. You could believe that that's a projection of your subconscious. You could believe that that is the actual spirit of your late mother or father. But I will say that no matter what you believe, clients tend to say that they really needed that as closure, or they have this sense that everything was okay with their loved one. So you can kind of see how we're targeting and treating these problems like grief, depression, and anxiety in a very different way.
I love that. And like that is what's so beautiful about psychedelic medicine and therapy to me, is that there's so many elements of healing. There's like the spiritual aspect of healing where like, you're processing emotions differently. And then there's like the actual brain science healing aspect, which is literally like a physical healing, and it's so multifaceted in terms of, that work, along with talk therapy and psychotherapy involved. So there's like so many of these avenues taken at the same time that are just parallel and headed towards healing. And it's really, really unique and really beautiful. And that kind of is a perfect segue into talking with Grant, who again is one of our former clients, who has experienced this ineffable psychedelic therapy experience. So Grant, what brought you to Field Trip? And, is there something specific you were trying to address or achieve?
Well, I think, excuse me, it's a bit of a long story, so I'll try to make it as short as possible. I was with the military for 11 years, and I served in Afghanistan in 2010. I was actually wounded in action in August of 2010. And my fire team partner, he died from his wounds, where I pulled through. And when I came back to Canada, I didn't know what anxiety was. I've never dealt with depression really like in my entire life. So it was just it was like I didn't die in Afghanistan, but the person I was sure dead. And I started getting anxiety attacks, insomnia, severe depression, and just dealing with pain management. It was a lot for me, and I did go down the prescription road, which wasn't. I was on that many prescriptions that I just felt like, well, I didn't feel anything at all. I was just going through life numb by all the prescriptions. And when I retired from the military, I switched to cannabis. And cannabis, this is just from my perspective, nobody else's. I know people that have have been prescribed cannabis, and it changed their life in a positive way. It changed mine when it came to pain management. For anxiety, depression, even traumatic. I was diagnosed with traumatic brain injury as well, with obviously with PTSD, and with those injuries, or it's kind of like a band-aid on a bullet wound. Sorry. So sorry, it's starting to get cold. So I was actually in university after I got out of the military, and I was having anxiety attacks, and like whenever I had a midterm coming up, I would kind of have an anxiety attack for a bit, and I was just going through school, and I finally graduated in 2021, and I was just mentally exhausted. I didn't know that's actually what depression was. Not so much I was sad, I was just exhausted, and I didn't really want to do anything else. And I was actually going to go to rehab for a couple of months just to kind of, get some rest and all that. And a couple of people I served in the military with told me about ketamine-assisted psychotherapy through a field trip. And they told me their experiences. A couple of them were saying that they hallucinated and they were back in Afghanistan, and it was just, their perspective on everything that happened. They made it from a negative to a positive. And I was kind of like, I'm not doing that. I'm not going back to a place that was, you can't even explain what that place was like. It was kind of like, yeah, that was a couple of chapters ago. We're kind of moving forward, but really, honestly, it was just dragging me down. So after I finished school, I was like, okay, I'll give it a shot. I really have nothing to lose, and kind of, that kind of thing. So I did 5 treatments in July of 2021 in Toronto, and it was after my first treatment, I couldn't explain like to the social worker what I hallucinated. I was back in Afghanistan. I was talking to friends that are no longer with us, but I just really couldn't put it into words. And I was like, oh, so the social worker out of field trip Toronto, Brian Fernandez, was like, you have a journal for me, right? And he was like, yeah. I was like, okay, I'll just write down some notes and we'll talk tomorrow, because I really can't make sense of what I actually what I saw, kind of thing. And I did 4 treatments after that, and I was supposed to do the 6th one, but I was living east at the time, and I had to move from out east back to Toronto during the pandemic. So I was kind of like, can I save the last one for when I moved to Toronto? Because moving a couple of provinces west, it's a bit much. So that was the end of August when I was moving, and it was the same month that Afghanistan fell, which was very. There was a lot of emotion around that, because so many of us have sacrificed in Afghanistan, and there were a lot of questions around what was the whole point, kind of thing. And I'm very happy I saved my last treatment of the 6 treatments for when I moved to Toronto, and I hallucinated again, and it just changed my perspective on everything that happened. So after the 6 treatments, before I did all the treatments, I had to do the pre-testing. So, just like for anxiety, depression, PTSD. And before I did all the treatments, it came back that I had an anxiety disorder and I was clinically depressed. And I concurred with that. And when I finished those 6 treatments, I did the same test, and my anxiety was 0 and my depression was 0. And it was just a life-changing experience for me. And since those 6 treatments, I do 2 boosters every 6 months. And it's kind of like a prescription in the sense of people who will take a prescription, like, oh, I feel better, and just stop taking it. It never turns out well, really, for anybody. And I kind of compare that to the boosters. It's like they're there, you might feel great, but you should probably do them every 6 months just in case. And that was, well, I started in July 2021, and I have an anxiety since. Like I never, like I have good days and bad days just like everybody else, but I haven't been depressed since. So, yeah, it's a life-changing experience, and I recommend it to anybody.
Wow, Grant. Well, first of all, thank you for your service and for being so vulnerable and open and honest with us about the experience, and overjoyed to hear that you found relief after ketamine therapy. It truly like makes my heart flutter, and you are so deserving of that relief. So thank you for sharing that with us. And I guess my follow-up question to you is kind of specific about the psychedelic experience, because it's very, it's uncharted waters to a lot of people. It's scary to a lot of people, quite frankly, like they don't know what they're going into. And as we talk about, a lot of people, some people go through these challenging experiences, and psychedelics often make you work through your trauma rather than around. And that's what makes it so powerful, but it's also a very courageous thing to do. And sometimes it's a scary thing to do. And that experience of reliving trauma is what often holds people back from going through this therapy. And I mean, I can't imagine, having the courage to go through combat again, like that is the epitome of something that a lot of people would avoid. So my question to you is, was the psychedelic experience what you expected? If you were going through a challenging experience, did you come out on the other side feeling relief or more clarity on things, or, reconciliation with some of your trauma? Like, what was the actual psychedelic experience like for you?
So the psychedelic experience is when I was back in Afghanistan, and just like a lot of people I served with who've also done ketamine assisted psychotherapy, they were back in Afghanistan, but they weren't seeing combat. They just saw it like something else, right? It's not going to give you, well, from experiences from anybody who's actually done the therapy, it's nothing that intense, like, but I find with the treatments, it gives you, the treatments, it doesn't give you what you want, it gives you what you need. Because again, talking to the veteran community of people who've done this therapy, like my first session was like, oh, I was back in Afghanistan. I was talking to comrades who either died in combat or by suicide after tour, and just like talking to them, and then them giving me just tell me what I needed to hear to keep going forward, and it changed my perspective on everything. Now, mind you, that was my first session. Just because that was my first session doesn't mean the person, anybody I served with, will have that same like experience in their first session. For some people, it was like their third or fourth, right? So it's different for because I mean, the human mind is it's a wonderful thing, but very, very mysterious. So yeah, like what my experiences were, it might be completely different from anybody else's, but at the end of the day, it's going to make you you're going to everything's going to be more positive after you do the treatments versus before.
Thank you for that. And Dr. Mike and Dr. Monique, if you want to chime in at any point about anything, please feel free. I just want to open up the floor to you guys if you had anything to add.
Thank you, Macy. Grant, thank you so much for, I echo what Macy said. Thank you for being so vulnerable. And also really kudos to you for being so brave to, go through this treatment, because a lot of people who have similar experiences to you, they feel, they can be in a place of stuckness. They feel like they maybe don't have the support in their lives to maybe move through this. They feel afraid of the unknown, which, there's a lot of unknowns when we do this work. That's something that we have to really acknowledge here. And I'm really glad, I'm glad that you brought that up. But yeah, I just really appreciate your perspective and your sharing.
I would say also at that point in my life, I mean, if you're talking about like in my situation, it was either you're going to rehab for a couple of months or you're doing this treatment.
Yeah.
You have one or two options and you're picking one of them. And when I traveled to Toronto to do the sessions, when I was talking with Monica's the nurse practitioner there at that time, and my social worker, they were walking me through the ketamine assisted psychotherapy process, like when I got to the clinic. And they're like, so, like, how are you feeling today? I was like, yeah, we're kind of at the edge of the plane. We're jumping out. We're not, it's kind of like trying to use that skydiving analogy. Well, yeah, I'm jumping out of the plane. So, I mean, you can talk me through this. I'm not really listening to you. Let's just get this done, because my anxiety was, it was high, because I've never taken psychedelics before. So I was extremely nervous. So it's for anybody who's looking to do the treatments, it's completely normal. Every single person who has done ketamine assisted psychotherapy and everybody has been nervous. So it's perfectly normal. So
that's a good point.
I also thank Grant for everything and for being here and for sharing your experience, and I think just I'm guessing based on the way that you're talking and also just assessing and sort of scanning and feeling your personality, you clearly had some PTSD to work on, but you also are very courageous. And, I think one of the nice things of in-clinic dosing and to a lesser extent, I think also our Freedom Hybrid at-home program is that this is a very personalized experience. So I'm not surprised that you probably had I'm guessing what we call like a medium or a high dose experience your first session. But what I would also say to anybody who's listening, who is maybe not even as 10 times more nervous than Grant about this work, we really do take that into consideration. So I have people in our first session, we start as low as and I think in Toronto, you guys are still you probably did oral. In Los Angeles, we're doing intramuscular. So you've got to do a little math, usually roughly multiply by 3. So sometimes if somebody's coming in and they're, number one, psychedelic naive, and they're really nervous, we'll start them with a very, very low dose, like 20 milligrams IM, which would be the equivalent of somewhere around like 60 to 75 milligrams oral. If they're coming in presenting like you, and it's like, it was either this or rehab, you might say, okay, let's go a little bit higher. Let's just like charge through. So I just want people to know. Oh, go on. Yeah.
Doctor, my anxiety and depression was that high that my first session, it was actually 75. It wasn't nowhere near. Yeah. It was nowhere near the end of my initial sessions or my boosters. I think I'm at, does 300 sound right? Probably.
Yeah, the typical starting dose is around 200 for the lozenge in Toronto, but we go as high as 700 now, depending on the person's needs. Now, if somebody comes in and presents with a history of being exquisitely sensitive to medicines, or they're very apprehensive around, trialing a psychedelic medicine, it's their first time, they're really nervous about it, we will definitely go lower and support the client and however they present and however they feel they want to move forward with the doses. So we're very flexible there. And everybody kind of, the tricky thing with lozenge and comparing it to IM, So there is a bit of math, and also there's a bit of variability in terms of the sublingual lozenge. There's a lot more variability in the way that people absorb that lozenge and process it. And so IM tends to be a little bit more direct, unfortunately, because of the jurisdiction we're in, we're not able to use IM, but actually we've had very profound transformational experiences with the lozenge as well. We just need to dose accordingly, which is why we're so flexible.
Okay.
Yeah.
And for those people listening, so if you are doing the hybrid program, it will be lozenges at home. And then most of our clinics are, when we say IM, intramuscular dosing, which is just a quick shot. That's very different than an IV ketamine model, where it's actually an IV needle in your arm the whole time. I've never had that experience, but as part of my training, I've had both the IM and the ketamine lozenges. And I prefer that. I would not want to be in the states that I've been in ketamine with a needle in my arm. So that's just a personal preference. But I think, Grant, your story really also illustrates the fact that we took your personality, your history, who you were, your depression and anxiety. We started you really low. And then, you followed the arc of most of our clients, which is we're sort of building the dose every session until we reach that sweet spot. And then sometimes dialing back on the boosters if it's been a long time, because the tolerance to ketamine is rapid in both directions. So if you're doing ketamine, you're going to build up a tolerance so you can kind of go higher. And then if you take, it sounds like you're on a 6-month boosters schedule. If it's been 6 months, you're going to feel it a little bit more intensely than that last session when you had a little bit of tolerance on board. But I think your story is just remarkable, and it shows just what this program can do for people.
Yep. Thanks, Doc.
Yeah, I agree. I actually, I had a quick question for you too, Grant, because you had mentioned something around the cannabis piece. And this is something that I hear a lot, particularly from our veteran clients. They're coming in with pretty high prescriptions, high doses that they're using on a daily basis to help manage their symptoms of PTSD, which totally makes sense. And interestingly, they may come in not having any goal around reducing their cannabis use and feeling that the cannabis is really serving them. And then as they move through the program, they find that actually their use tapers off quite precipitously, and oftentimes they stop using it altogether. And I'm curious about your experience. It sounds like perhaps the cannabis as a medicine wasn't serving you quite as well as maybe some other people have found benefit, but I'm just curious if you have any insight there.
I actually I don't consume remotely as much cannabis now as I used to. So with ketamine-assisted psychotherapy, I just never, since doing it, I've still used cannabis for pain management, because I took blast wounds in Afghanistan, so like my right lower leg, I took the shrapnel wound in my stomach, so I still got like some bits and pieces of a bomb still in my back, and my right hand, and another piece went through my ear and out the back of my head. So I still use it for pain management, but when it comes to post-traumatic stress disorder, I don't.
Okay. Thank you for sharing. Yeah.
But if it's like the summertime, it's like I don't. It's just like when it gets, because I do live in Canada, so it gets cold here. So arthritis, and it's when I use a bit more cannabis than in the summer, but yeah.
Yeah, that's very, very much in keeping with what I've seen clinically so far. Yeah, so thank you for sharing.
Thank you so much, Grant. Again, it's really great to hear from somebody who has gone through the program. It's a really important perspective, and you sharing your story is truly helping us carry the torch for psychedelic therapy as like a real effective modality of healing. So thank you very much, Grant. And yeah, I would like to pivot, if we could, to talk about our new program called Freedom. We just launched it late last year, and Dr. Monique is going to be able to kind of give the lowdown on what it's all about, how it's different than in clinic. So Dr. Monique, what is the Freedom program exactly, and why did we create it?
Thanks, Macy. That's a big question. Maybe a big segue for a big program that we've launched. So the Freedom Program is unlike any offering that we've been able to provide so far at Field Trip. It truly is a hybrid model program where we are trying to harness the best of at-home ketamine with the best of holistic wellness and the best of in-clinic support. So it's really sort of this like perfect trilogy in my mind, let's call it. So the first thing is sort of at-home models. So there are a number of at-home ketamine programs currently available. I think what really distinguishes our program from a lot of these other programs is, well, there's a number of factors, but a big one I think is a large emphasis or focus on holistic wellness offerings. So what I have been seeing in the holistic wellness community is, first of all, there's a lot of people who are using medicines underground and really trying to harness the powers or the healing potential of yoga, mindfulness and meditation, sound healing, all of these things, and really trying to gear them in a time when their brain is experiencing neuroplasticity after they've been using these medicines. And so we're trying to actually provide this service all in one place for patients where, they're doing their medicine, their at-home ketamine medicine, they're still receiving psychotherapy, they're still receiving preparation and psychotherapeutic support. And now they have this additional ability to be able to do their mindfulness in a group or community setting online, or learn about various aspects of nutrition that are really important for improving their mental health, moving through a yoga or movement class. So all of these things we've decided to make sort of on a regular sort of weekly offering basis. We also have this amazing new psychoeducation series. Dr. Mike Dow actually did our first one. He's going to present again next week. It's so amazing. So we're going to be having experts in the community of psychedelics talking about anything from like ego and what is the self, like Dr. Mike Dow was talking about last week, and IFS, which is an amazing psychotherapeutic tool used in the psychedelic realm. Everywhere from that to psychedelics and substance use disorders, to ADHD, to all of these different sort of topics that we're really interested in educating people on. So I'm really, really excited about that piece too. And then we also have the ability for our clients, unlike any other at-home ketamine program, to be able to book a session and do their dosing in clinic with our clinical team. And I think that's really important for clients who, don't have psychedelic experience. They're really nervous. They have never done this before. It's scary, as we just heard, and having that extra level of support is super duper important for those folks. And so we want to be able to provide that for people. It's also a really beautiful way to provide a community-based experience. And we really have to acknowledge that these medicines, ketamine less so because it's a newer molecule, but psychedelic medicines in general have traditionally been used in a community setting, right? Like they come from indigenous culture and they were always used in a community setting. And we really want to acknowledge and respect that and be able to provide an opportunity for people to heal in community. And I think that's really, really powerful. So all of that to say is we are trying to leverage the best of all worlds and combining it here in one place. Really accessible. People have the ability to, do this at home, come in. Because it's largely virtually based, we're able to bring the price point down. So it does make it more accessible for people, which I'm also very pleased about because I think that there is a huge need. And unfortunately, the cost has been really, really high to date because these methods of delivery are quite expensive, right? There's a lot of psychotherapy, there's a lot of admin, we have a lot of clinical need or requirement from our teams. And so this is another way to be able to bring value, but also support our clients in a really meaningful and beautiful way.
Wow, mic drop. That was really great, Dr. Wade. Thank you. Thank you very much. Yeah, the Freedom Program is exciting because it's very, it's lifestyle, it's week by week, more than the medicine. Like the medicine obviously is a very big part of what we do. It's always the spirit of what we do, but having this holistic healing and wellness classes that go around it that can help you prepare and integrate and like this like rinse and repeat in that regard is is really special. And I personally have never seen it done before, possibly ever in the world. So the offering it's really awesome. It's flexible. It's way more affordable. And it's very unique. So I feel proud to have put together this program where people could dose at home or in a group setting, which again, as you said, is kind of the origin of the psychedelic experience, is sitting around a fire and being with people on the same journey as you. And it's special. So with that in mind, if people are choosing to dose at home, which I know, and we'll talk about the qualifications soon, but if they are dosing at home, they're likely feeling a little bit more confident about psychedelics. We do require a trip sitter, so like that's something to keep in mind. But with the at-home experience, how is Field Trip prioritizing safety, and how are we kind of creating the container around clients without actually being there as a therapist holding their hand?
Such an important question, Macy. Thank you for that. So safety is something that we have been we've been very, very mindful of since the beginning, because we're recognizing we're making a very big pivot from in-clinic offering to really entrusting our patients to be able to hold this medicine in a safe space at home, and to practice with a lot of reverence as well. That's very important for us. So the first thing is that we are doing a very solid assessment of people as they're coming in to make sure that they're safe to do this at home. So they don't have any mental illness that involves psychosis or mania, recognizing that these may potentially be triggered or activated, and they may not have the insight to be able to access the needs, the care that they need. So ruling out patients that may not be the safest to be able to pursue an at-home offering, and really ruling in the patients that would do quite well with this program. So that's number one, is making sure that we're working with the right people. And if a patient is determined not to be eligible for our at-home offering, of course, we're going to be working with them to be able to troubleshoot and potentially get them into our clinics as well, or support them with a psychotherapy program, which Field Trip is also potentially going to be involved with really soon. So there's different avenues there. The second thing is we take the preparation period very, very seriously for this program. So the way that the dosing structure works at home is we actually don't recommend people start dosing until week 3, and everything is mapped out really well. And those first 2 weeks are really important to develop a solid foundation around understanding what set and setting means, how to choose a sitter, what to do if an emergency situation arises. And all of this is beautifully laid out. We've created a lovely program guide. Everything is available in our portal. We have access to clinical teams should questions arise. So these are really important for us. The other thing is that should something come up in the experience, we've actually developed a bit of a collaboration with Fireside Project, which is a not-for-profit organization that supports individuals who are experiencing challenges in their psychedelic experience, and they may require additional support. And it's an anonymous peer-to-peer program. So that's really great to have them on board. And that information is also available under the safety section in our program guide. So that's a big one, and I was really proud to sort of foster that relationship with the founder. He's really, really amazing in what he's doing. And then finally, we also have unlimited group preparation groups, community-based groups, and then also integration groups. And so we're really encouraging people to get connected, learn in community, integrate in community. And then also we offer the one-on-one integration sessions as well as part of our program. So they're able to connect with the therapist and really tease out the parts that are coming up for them in the sessions that are maybe confusing, they need help sort of putting back together.
That's great. Thank you, Dr. Monique. It's really heartwarming and inspiring to hear that, because there's a lot of at-home ketamine companies now. They're all over the place. We see them on our Facebook feeds, they're all over. And I see jokes about it being mail order ketamine all the time. And there's a lot of risk reduction that needs to be done. And I feel like Field Trip is really doing that well. giving everybody the tools they need, the container they need, the before, the after, the really, really important aspects of safe and intentional psychedelic journeying. We're offering people that, and also the flexibility of doing it at home at a lower cost. So I know all of those were deeply considered when we were putting together this program. We didn't just want to send people ketamine and send them on their way, because the therapy aspect is so important. The integration aspect is so important. So I feel really proud that Field Trip is doing this with as much mindfulness as we are. And I know a lot of it is because of you. So thanks, Dr. Moon.
You're welcome. It's definitely a team-based effort for sure. I feel very privileged to work with an amazing team, and everybody's been working really hard to make sure this gets on track. And yeah, it's just been really well thought out. And we have a lot of very brilliant clinicians that have been contributing to the content and this whole process. So I'm feeling really confident that we're in a really good space to keep people safe.
Amazing. Love it. Dr. Mike, I don't know if you had anything to add about freedom specifically. If not, we could go to audience questions.
No, I think Dr. Monique, as always, does such a brilliant job. I'm just so glad that, just to echo what you said, if you don't live near a clinic or have the means to, and I have people doing this all the time now, flying in, staying in a hotel in Santa Monica for a week. It's wonderful, but we also know not everybody can afford that, or you're busy, you're parenting, you can't do that. So to be able to deliver this treatment and reach the people who maybe need it the most, I'm just really proud that we're doing it in such an ethical way. So
yeah. Well,
yeah.
Awesome. Okay. Well, I'm going to read out some audience questions, and then either one of you feel free to jump in. I'll just go in order. I'll try to go in order from what I saw. So our first question is, how is eligibility determined on a case-by-case basis if a client has a personality disorder diagnosis? Do certain PDs make one ineligible? For instance, borderline personality disorder versus antisocial personality disorder.
Mike, do you want to take that, or do you want me to take it?
Yeah, I have an opinion, but I'd love to hear what you say first.
yeah, of course. So I would say that, so I do consultations in Toronto, and the way that I assess people is very comprehensive, actually. So I can't say that like one diagnosis either rules someone in or rules them out. I think it really is the collective, the wholesome assessment. And so if somebody, let's say, has an antisocial personality disorder and they're very symptomatic and they have a really hard time engaging in treatment and they're not able to really commit and they are very, very guarded, it may be that they're not fully ready to engage in a treatment like this. Having said that, does it mean that all patients in that situation are not fully ready or not able to engage and sort of harness the power of the medicine? Not necessarily. Again, like there's so many other factors. Do they have supports in their lives? What does that look like for them? Do they have other comorbidities in terms of their mental health? Are they navigating other complex medical conditions? Like all of these things taken together are really going to allow us to make sort of a decision on whether this person is ready or not, or maybe they're not ready yet, and we can work with them to get them ready in a few months to engage in their treatment. But I wouldn't say it's a hard and fast rule necessarily. Some personality disorders, it's true, may be more difficult to treat with medicines, including ketamine. But again, that's not to say that we can't rule these patients out. It just means that we have to take a closer look at what else is going on in their lives.
I think this is a really great example of people who probably need a lot more one-on-one care. And paradoxically, what I've seen is that while yes, it may be harder and we may have to really wrap around these people a little bit more, it's such a paradox, right? Because to me, if you have narcissistic or antisocial personality disorder, or maybe to a lesser extent, borderline personality disorder, it's, sometimes the ego is so overactive. And if you have a medicine that can help you to step outside the ego and connect with self, these personality disorders across mental health in general are hard to treat, but I think we have something that for the right person at the right time with the right support has, in my experience, proven to be a very powerful tool. and maybe exactly in terms of like the neurochemistry and the spiritual and the biological component of it, really allow that person to be treated, and treated well, and get to the root cause of their problems.
That's great. Thank you both very much for that. Great answer. The second question we have is, few questions here. It says, I have had one very bad experience with psychedelics, which leaves me extremely anxious to try it again. One, how can I best approach this? And two, is it possible to see the location where the treatments will happen and have a conversation with somebody on location before committing to the full process? Anybody could jump in. And also, Grant, I just want to mention that if you have any perspective on any of this, feel free to jump in too.
I would really want to know, number one, what was the medicine? What was the dose? What was the set and setting? Where were they in their life? And I would also say that as we were talking with Grant about his dose and his, sort of starting low and going slow and then titrating up, what I would do for this person is I would absolutely do what we do a lot of times, especially in the first couple of sessions, we'll do a split dose. So, usually the medicine is injected all at once at the beginning of the treatment. But we can also split the dose. So in Santa Monica, what we do sometimes is we'll give people a very small dose and then 10 minutes later come in and offer the rest of the medicine if they're ready. So if that's what I would do for this person, I would say, let's just give you a really small dose, your first session. And then, 10 minutes later, I would check in with you and say, like, do you want to go any deeper? And I think that baby step really allows people who have, something wasn't optimized. Maybe it was the wrong medicine, again, wrong time of their life, set and setting was not optimized. I think we have had some open houses, generally, and some of this just has to do with the laws around what clinics have to do to keep the medicine safe. Typically we keep our clinics locked just to follow guidelines. So it's not, that being said, I think if it was like an individual case, if somebody reached out to me, I would absolutely figure out a way to make an appointment with that person and walk them through the clinic, even though they can't, just come to our clinics and walk in.
Yeah, that was perfectly stated, Mike. I probably wouldn't add anything, really.
Do you mind if I?
Please.
So, a lot of guys that I served with, after some people have done all 6 treatments and they've went back for boosters. A friend of mine, he did 3, and he served in Afghanistan about 15 years ago, and he's had issues with that ever since. But the thing is, too, with trauma, life doesn't care. So you are going to have more trauma with loss as life goes on, unfortunately. And my friend recently lost somebody close to him. And that was when he decided to do the treatments, and he did 4, and he just didn't want to go back. And he told me that he wants to go back and do the last 2 treatments, but I think it was his 4th treatment. It kind of had a bad experience, and it does happen. And he wants to do the last 2 treatments, but it's he just needs a minute after the 4th treatment.
I just actually going to piggyback on that, Grant, and I really want to sort of emphasize this point. It comes up a lot in the psychedelic community, this idea of having a bad trip or a bad experience. And these words bad, good, they're very polarizing. And I think something we may want to consider moving away from, because what we see with medicines is that even if someone is having a challenging experience, we kind of try to use that terminology, which is a little bit different, or a paradigm shift. A challenging experience may be really difficult to move through, but there's often a lot of information that comes from it, and there's often a lot of learning. And still in this integration period afterwards, in this neuroplasticity period, we can have a shift in perspective, new insights downloaded. And certainly I've seen people who've had these challenging experiences actually have quite profound shifts afterward. And so I think what is really critical is having the psychotherapeutic support to be able to allow one to meaningfully integrate these challenging experiences. And that's something that I think we continually come back to at Field Trip. We
That's
don't
right.
just offer these medicines without the psychotherapeutic support. And we often, I always, but generally speaking, I think the team does too, caution people that the medicine work, while it's very beautiful and very transformational for most, it can be a bit destabilizing at the beginning. You know, it's kind of like peeling back the layers of an onion, we say, and sometimes when we're peeling back, there may be discomfort, there may be things that we learn about ourselves or the way that we perceive the world. And that can be really uncomfortable, and it can shake us to the core almost, you know, and to be able to move through that with ease really does require a very skilled therapist that does this work meaningfully and well and mindfully. And so this is something that I think is super critical when we're moving forward with psychedelic medicines, including ketamine.
Well said. Well said.
That was great. Thank you, Dr.
Yeah,
Monique.
I agree.
Great. Okay, so I'm going to go to the next question. I know we're running out of time, so we're going to try to go a little quickly. So this is a good question. It says, I've tried all forms of ketamine treatment, which have been life-saving: Spravato, ketamine IV, ketamine IM, and lozenges. Unfortunately, the lozenges do not give me the same deep subconscious experience or clarity that I was getting with the other forms of treatment. Do you have any feedback on the suggestions? I want to refer a friend to your facility, but I'm worried that the lozenges won't help him with deep trauma and depression he is experiencing.
I would say that this person is in the minority, and a very valid point. You know, I was working with somebody who actually owns an ayahuasca center, and he has also done all of the models of ketamine delivery. And when he sort of came back into the room, he said to me, man, there is nothing like IM ketamine, because IM ketamine, it's all going right into your bloodstream, front loaded at the beginning of the session. So IM ketamine to me goes like this, and then you float down. IV ketamine, you're sort of being delivered a steady state of the medicine. So it's sort of like this. And oral is sort of like this slow build up and then a slower build down. It kind of feels like more of like a gentle up and down roller coaster. That being said, most people, I think, especially with who have not done a lot of psychedelics, will have the ability to go just as deep with the oral. For the vast majority of people, I've seen they can reach that with the right dose. It's a little clunkier, or however, choose your adjective. It's either clunkier going in or more gentle going in. But I think if you get the dose right, most people can get there.
Yeah.
And that's part of the reason why we raised the max dose in our Toronto clinic, understanding that some people just don't absorb in the same way as others.
Yeah.
So we do have the flexibility. It's quite a range, you know, like anywhere from 100 up to 700 now that we can go. So that's quite a big range there. But I agree with you. I mean, certainly the pharmacokinetics of like the absorption, the way that the molecule is distributed to your body and thus crossing your blood-brain barrier is quite a bit more abrupt, let's say, with the intramuscular dosing regimen. A lot of people describe the lozenge as more gentle coming on. It does mean that it lasts longer and takes a little bit longer to come off. And also recognizing that we are giving a higher dose, which means sometimes people feel the effects, not necessarily the psychedelic effects, but they may notice feeling a little bit more tired or out of it for more hours after, or essentially more hours after their dose. So that's something to consider too. But you know, the real difference, like at least in Toronto, is that as far as I know, you know, the IV clinics that are doing ketamine don't offer the psychotherapy. And so this is really the big difference in, you know, our program versus others in Toronto anyway, is that truly we believe so strongly in the psychotherapeutic components, really critical.
Thank you. Thank you very much. I'll take the last question because I know we're over time. Will the amount of sessions be determined on what you need? Is it possible to do less more? So I think this is a good opportunity to talk about why we suggest 4 to 6, and kind of like how the sessions are personalized for clients.
Really good. I mean, I think based on what I've been seeing, it tends. So as I mentioned before, the medicine work can be a bit destabilizing as it before it's like sort of restabilizing. And so sometimes we need to see this peeling of the layers before we can really get at some of the core issues. And I think Dr. Mike alluded to this earlier too, or maybe it was you, Grant, that the medicine gives you what you need. And it often takes a few medicine sessions to really start to access the parts of you and allow this vulnerability to come in, for you to be able to work more deeply with some of these very deeply rooted issues that, you know, could be related to childhood trauma or things like that. And it often also takes time for people to fully trust the container, even though we create a wonderfully safe container with our amazing therapists and our beautiful clinics and just like our amazing clinical staff and team. But I think that it really does take time for people who have extensive trauma histories to really let go. And that's where I normally start to see a lot of shifts for people happening around like the doses 4, 5, 6 range. It also happens to coincide with higher doses in our Toronto clinic. But I think that some of these components are really critical in that they're really allowing themselves to be to feel safer and just go more deeply. But maybe Dr. Mike, if you have anything to add there.
Yeah, just sort of going back to some of the research that, you know, with a couple of sessions, you're going to feel good and you're going to start to scratch the surface, and maybe there's a few layers of that onion coming off, but we really don't see that the mood improvements last. So, you know, I think stacking 4 to 6 in general is actually far more effective. And then we reach that sweet spot with psychotherapy where the effects are lasting for months. You know, for Grant, it was 6 months. For other people, I like to do my own personal work, 1 ketamine session every quarter. So about every 3 months, I can feel it brightening my brain. And if you reach it, and I know it's both expensive and time consuming to start, but it's also, you know, I think one of the greatest things that, you know, when I was thinking about Grant and his life and, you know, this idea of, do I want to take a psychotropic medication that numbs me every single day indefinitely, and the symptom relief only lasts for as long as I take this pill, and, you know, by the way, it's hard to stop this pill and all these other things. I think people really get a sense of freedom by getting to that state, getting over the hump of our initial 4 to 6, which again can be daunting. But then if you stay on your maintenance dose, you're coming to us once a quarter. For Grant, once every 6 months, once every 60 days, you get the quality of life back. There's none of that typical numbing with ketamine-assisted psychotherapy that we tend to see with SSRIs or SNRIs that are typically used for PTSD. Usually it's an SSRI or sometimes an SNRI for depression, anxiety as well. And I would say, if anything...
Oh no.
If anything, what?
Cliffhanger.
No. Oh, he was on a roll. He got excited and
it was going so well.
Yeah, clicked the X by accident.
Yeah, what's worse that he was on a roll too, so that's what made it so much worse. Yeah.
Oh.
It's his good vibrations. The internet couldn't handle it. You know?
Yeah.
Oh, he's coming. Here he goes.
Oh, did we miss that?
Yeah.
So SSRIs typically have a blunting effect, and most people with ketamine, quite the opposite. It helps people to feel more alive than ever, right? Like discovering your true self, having this sense of, when you're in self with a capital S, this sense of chi, this energy, this life force through the body is what some people say, or just feeling like your true self, getting rid of the masks or not letting the inner critic within you that resides in a part of the ego run your life. And that to me is the best part. And that makes it really well worth it.
Thank you so much. I think we're going to end there because we're over time, but Dr. Mike, Dr. Monique, Grant, thank you 3 so much for spending your evening here on Livestorm. It goes such a long way. Everybody who joined us in the audience, thank you for your questions and spending your evening with us. If you want to get started, or this is intriguing, or you have more questions, please feel free to reach out to us. We are always available to answer anything you need to help you get started. The audience member who wants to tour the space and kind of get comfortable with the clinic before thinking about working with us, please feel free to reach out to us. We could definitely make sure you feel comfortable and get that sorted out for you. Visit our blog. It's fieldtriphealth.com/blog. If you have any questions, you want to learn about the brain science of ketamine, you want to learn about the field trip experience, anything under the sun about ketamine-assisted psychotherapy, we have there. Reach out to us on social media. Any way that we can help you along, you know where to find us. So thank you all so much again, and hopefully we'll talk to you soon.
Thanks, everybody.
Thank you, guys.
Thank you for having me. Thanks, guys.
Bye.
Bye.
Bye.